So we will see the plan for diagnosis of scrotal swelling. So first of all, we must ask a few questions, or rather answer a few questions. So questions to be asked / answered. So what will be the first question? The first question will be, can you get above the swelling? So one of the most basic questions is, can you get above the swelling? The second question will be, can you identify the testes and epididymis? So can you identify the testes and epididymis? And the third question will be that, is the swelling translucent? The fourth question is the swelling tender? So these are the 4 questions that we have to ask. So first we'll discuss the swellings that are not confined to the scrotum. So swellings that are not confined to the scrotum. The first one would have a cuff impulse, is reducible, and testes is palpable, is opaque. So what will this be? Cuff impulse, reducible, testes palpable, opaque. Of course, it's a hernia. The second type of swelling that is not confined to the scrotum would be having no cuff impulse, testes would not be palpable, would be non-reducible, and translucent. So what is it going to be? So this is a infantile hydrocele. So now next we'll discuss about the swelling that is confined to the scrotum. So this is a bit more complex. Swelling that is confined to the scrotum. So we can again divide it. So testes and epididymis are not definable, and the next category would be that testes and epididymis are both definable. So when testes and epididymis are not definable, it could be either opaque or translucent. So the translucent swelling would be a vaginal hydrocele, and once again opaque would be divided into non-tender and tender. So non-tender swelling would be chronic hematocele. Second, a gumma, and third is tumor, testicular tumor. Then if the swelling is tender, then what is the diagnosis? It's torsion, acute hematocele, or severe epidydimoorchitis. So let's then go to the other branch, that is testes and epididymis are definable. So translucent, opaque, once again the same. So the translucent swelling would be cyst of epididymis. Then going to the opaque part, so it could be tender. So a tender swelling would be acute epidydimoorchitis. Then non-tender. So a non-tender swelling would be tumor. See, tumor is non-tender mostly. Second would be tubercular epidydimoorchitis. So tumor, tubercular epidydimoorchitis, these are both non-tender. Tender is acute epidydimoorchitis. Torsion, acute hematocele is tender. Severe epidydimoorchitis is tender. Non-tender swellings are tumor, gumma and chronic hematocele. Then translucent swelling is vaginal hydrocele or cyst of epididymis. So we'll revise it again. And then hernia and infantile hydrocele are not confined to the scrotum. So let's revise it. So questions are: can you get above the swelling? Can you identify the testes and epididymis? Is the swelling translucent? And is the swelling tender? 4 questions. So swelling not confined to the scrotum and swelling confined to the scrotum. Swelling not confined to the scrotum could be either a hernia or infantile hydrocele, depending on the cuff impulse, reducibility, testes, palpability or not, or opaque and translucent. Swelling confined to the scrotum, so not definable testes, opaque or translucent, and then these are the diagnosis.